Well, my friends, this is a case of malignancy of liver. This gentleman, aged about 63 years, brought to me by one of our homeopathic physician from Nadia district. One physician, Dr. Anabi Rai, sent this patient to me. The case is a malignancy of liver. The CT scan of upper abdomen reveals that one 15 into 15 millimeter ill-defined enhancing soft tissue lesion in the liver. So definitely some obstruction in the liver, obstruction in the flow of bile, a result of which the bilirubin is increased 25.2 milligram. The alkaline phosphate also increased in 560 international unit. So normally the bilirubin may increase due to hepatitis, etc. But when the alkaline phosphate is increased, definitely the case goes toward malignancy. So the case is a malignant one. In the past history, there is history of operation in the gallbladder, which is also mentioned. When I have seen the ultrasonography report, here mentioned no visualized gallbladder. Gallbladder is not visualized within the fossa. So definitely there is history of operation of gallbladder. So I asked them to show me the biopsy report of gallbladder to see whether the malignancy was started since the operation or prior operation it was observed. But the biopsy report reveals that no evidence of malignancy seen at that time. No evidence of malignancy of gallbladder. It was doubt to me, probably the malignancy started from the gallbladder and the surgeon didn't care that or looked after that. But at the time the gallbladder was normal. Post-operation of gallbladder, when biopsy done, it was normal. Now the growth in the liver is the later stage. But surprisingly enough, the man didn't take any amount of alcohol, neither he had any addiction to tobacco, etc. He is a purely religious person, a fair-minded person, but still is suffering from malignancy of the liver, forming with a large mass. Now, what will be our prescription? Probably the case is metastasis. Now, the conjunctiva is full of yellow. Takan. The conjunctiva is full yellow. To see the conjunctiva in clearly, you just pull the upper eyelid upwards. Then you will finally understand the color of conjunctiva. To see the anemia, you pull the eyelid downwards. To see the anemia, pull the eyelid downwards, and to see the jaundice, pull the eyelid upwards. This is the normal phenomenon, my friend. So, ব্যথা আছে এখানে? ব্যথা আছে, একটু ব্যথা নিচের দিকে ব্যথা আছে। Now, what is my prescription? Number one, the problem is in the liver. So, if we look after the spheres of action of any medicines, there are some medicines acts over these organs specifically: Chelidonium, Lycopodium, Nuxbum, Podophyllum, Cardus marianus, etc. So Lycopodium is one of them. Now other symptoms of Lycopodium I have observed. There are warts under the eyelids in the right side, but not in the left side. So some symptoms aggravated or found in the right side matters little. I have not given too much importance to this symptom, but at present he has described two peculiar symptoms: dryness of the throat, গলাটা শুকিয়ে যাচ্ছে, and cramping pain in the lower limbs, পায়ের পিছন দিকটায় কামড়ে কামড়ে ধরছে। সো লিভারের কমপ্লেনের সাথে গলাটা শুকিয়ে যাওয়ার কোনো সম্পর্ক খুব একটা থাকে না। সো আমাদের বুঝতে হবে যে পার্টিকুলার সিমটমসের মধ্যে কোনটা পিকিউলিয়ার। পেটের সাথে গলার সম্পর্ক নেই, তাই আমি দেখতে চাইলাম রেপার্টরিতে থ্রোট ড্রাইনেস সেন্সেশন কী কী মেডিসিন আছে। দেখলাম কেন্স রেপার্টরি থ্রোট, the chapter throat, dryness sensation. There are many medicines and Lycopodium is one of them in the first grade. Cramping pain in the extremities. If we go through the Ken's repertory, extremities, pain, there is no rubric cramping. This is burning, starting C, cutting. So cramping, CRAMP or colicky, there is no rubric in extremities, either no cramping or no cutting. Then we may go through the general chapters to see the pain, cramping or cutting. Unfortunately, Ken did not give also cramping or cutting there. Some rubrics may be seen in other way. There is a booklet by Dr. Shankaran, and I have searched the rubric whether he has given any cramping or cutting pain. He didn't mention. But in Shankaran's on pocket repertory, I had a pocket repertory of Dr. Shankaran. He has given pain, cramp or colic. Any symptoms belongs to cramp or colic like, there is Lycopodium in the first grade. So reference books are very essential. This is the pocket repertory of Dr. Shankaran. Nowadays his son, Dr. Rajan Shankaran, is not interested to publish his father's books. He is more interested to publish his own books, which has no value to me. Shankaran, his father, Dr. P. Shankaran, was the great Shankaran, the great man, a great homeopathic at that time. So cramp, and he has done a lot of works for the service of homeopathy. So the great Shankaran had published one pocket repertory, and there is cramp or colic pain, Lycopodium in the first grade. Throat dry sensation, Lycopodium in the first grade. Action over the liver, Lycopodium is no doubt an important medicine. So let's see what can we do for this poor patient who is definitely suffering from the malignancy of liver, and the malignancy has already metastasized to surrounding parts. So it is better to prescribe Lycopodium in 50 millisimal scale of potencies. So let's see the result, what we may expect from this greatest antistory when we are prescribing in 50 millisimal scale of potencies, because these potencies have less chance of aggravation and can smooth freely. So with the direction thrice in a day, Lycopodium I have prescribed. So this is called art of prescribing. Many homeopathic physicians are giving lectures, theoretical posts in the Facebook. But while prescribing a correct medicine, to show, to demonstrate the points, the angles, how he have arrived, how they arrived, how he has arrived, how he has come to the conclusion to select one single medicine, they are unable to demonstrate. They are helpless. Only to big talk, and that's why I am telling, though it feels to me that talking like arrogancy, but I must say you are the large monkeys, large belly, but to prescribe a correct medicine, to arrive a similum of medicine, you are in that proverb, Ceylon jumping melancholy.